Adjumani district joined the rest of the world to commemorate the International World AIDS Day 2025 at Adjumani Model Senior Secondary School playgrounds under the theme Building a Sustainable HIV Response to End AIDS as a Public Health Threat, where leaders, partners and community members are expected to renew their commitment to prevention, treatment and stigma reduction and rewinding gaps to fight HIV and AIDS. Coma Christine, a young mother, appealed to the fellow youths to embrace abstinence because early pregnancy and HIV is real.
For my brothers who are here today, I want to encourage you guys, go back to school. For you who are there in village, try to give them advice so that they go back to school like the way I am today.
Adima Joseph, the program manager at Fawe, stated that as an institution they have committed resources to disrupt the spread of HIV and AIDS and teenage pregnancy among young adults in schools.
As Fawe, we commit resources. We commit resources to ensure that we have intervention that disrupt the spread of HIV, intervention that disrupt GBV in the community. Fawe has been here for quite long. And as far as we have been able to inject funds into various activities that we see contribute to reduction of HIV among young people, contribute to reduction of violence amongst our families, so that we're able to protect the girl child, protect the boy child, make sure that our families are safe, that can be able to nurture young people.
Dr. Trametu Dominic, the District Health Officer at Adjumani District Local Government, stated that nationally HIV and AIDS prevalence of 2022 stands at 5.1%, which West Nile gives it 2.3%. He further stated that Adjumani District trends more than West Nile with percentages of 2.5%, pointing to 110 new infections and undiscovered ones amidst people.
Nationally, the HIV prevalence as of 2022 UDHS stands at 5.1%. The one of West Nile is at 2.3%. The one of Adjumani is 2.4%. You can see our prevalence is higher than the average of West Nile. We are in West Nile region. New infections. The last 1 year from July last year to June this year, we had 110 new infections. These are the confirmed ones. We still have those which are not tested, and we still have those who do not know their status. Government of Uganda, the Ministry of Health, has put several strategies to ensure that we make HIV history by 2025. Including malaria. That malaria is getting history.
Atim Brenda, from the Office of the Prime Minister Adjumani Refugee Desk Office, stated that the commemoration is a way of creating awareness as a well advocacy to the world as HIV and AIDS is real and kills.
Commemorations are our way of awareness, advocacy as well. We advocate and remind the world to be able to remember that AIDS is real and it's a killer disease. With the theme we have today, we have building a sustainable HIV response to end HIV as a public health threat. I'm very grateful that we are having Fawe with the referral pathway as well. Under that theme, we realize that we have to work together to attain the theme as it is for this year. The referral pathway enables us to receive all the services from the medical services and a way of prevention.
Emmanuel Okware, the Deputy Resident District Commissioner at Adjumani District, stated that the theme reminds the people that collective effort can accelerate the progress towards HIV and AIDS control.
Focusing on the theme for World AIDS Day, which is overcoming disruption, transforming the AIDS response. This theme focuses on addressing the challenge posed by funding cuts and disruptions to HIV/AIDS and services, vulnerable populations, and promoting sustainable global cooperation and human rights-centered approaches to end AIDS by 2030. But for our case in Uganda, our theme for World AIDS Day being building a sustainable HIV response to end AIDS as a public health threat, we are reminded that our collective efforts can accelerate progress towards a world where HIV/AIDS is a manageable condition. Uganda has made notable strides in HIV prevention, treatment, and care. We've expanded access to antiretroviral therapy, reduced mother-to-child transmission, and promoted awareness. Let us champion inclusivity, education, and support for those living with HIV/AIDS.
As we observe the World AIDS Day, stakeholders have been urged to reaffirm their commitment to ending HIV and AIDS epidemic by bridging the gap and ensuring everyone has access to prevention, treatment, care in order to promote awareness and support in those affected by HIV and AIDS. Onzima Alan, Okumuringa Christine, Nilecast.